In this video, we describe the long-term implications of a COVID-19 on our health. Doctors in a large Chicago medical center found that more than 40% of patients with COVID-19 showed neurologic manifestations at the outset, and more than 30% of those had impaired cognition. However, new research is now suggesting that there may be long-term neurologic consequences in those who survive COVID-19 infections, including more than 7 million Americans. Particularly troubling is increasing evidence that there may be mild but very real brain damage that occurs in many survivors, causing pervasive yet subtle cognitive, behavioral, and psychological problems. COVID-19 can cause damage to the brain directly by encephalitis, which may have devastating or subtle consequences. In one British study of 12 patients with encephalitis, one made a full recovery, 10 made a partial recovery, and one passed away. This study also found that a number of patients with COVID-19 suffered strokes. In fact, COVID infection is a risk factor for strokes. A group of Canadian doctors found that individuals over 70 years of age were at particularly high risk for stroke related to COVID-19 infection, but even young individuals are 7 times more likely to have a stroke from this coronavirus versus a typical flu virus. Autopsy data from COVID patients in Finland suggests that another major cause of brain damage is lack of oxygen. Particularly worrisome is that several of the patients who were autopsied did not show any signs of brain injury during the course of their COVID-19 infection, yet all had brain damage. In one patient, there was loss of taste, and in 2, there was minimal respiratory distress, but none of these patients were thought to have any brain damage while alive. In survivors of intensive care unit, stays due to acute respiratory failure or shock from any cause, 1/3 of people show such a profound degree of cognitive impairment that performance on neuropsychological testing is comparable to those with moderate traumatic brain injury. In daily life, such cognitive effects on memory, attention, and executive function can lead to difficulties in managing written materials and finances, or even carrying on casual conversations with others. Commonly observed long-term psychological effects of ICU stays include anxiety, depression, and PTSD. A Chinese group of doctors and researchers examined several aspects of cognitive function in 29 individuals who were thought to have fully recovered from COVID infection. They found persistent impairment in sustained attention, the ability to attend to important information for as long as it is relevant. Silent strokes typically affect the brain's white matter, the wiring between the brain cells that enables different parts of the brain to communicate with each other. This wiring is essential for attention, and when damaged, sustained attention is impaired. Although many people who have recovered from COVID-19 can resume their daily lives without difficulty, even if they have some deficits in attention, there are a number of people who may experience difficulty now or later. One recently published paper from a group of German and American doctors concluded that the combination of direct effects of the virus, systemic inflammation, strokes, and damage to bodily organs like lungs and liver could even make COVID survivors at high risk for Alzheimer's disease in the future. More will definitely be studied by health specialists, but until then, all we can do is wait. Stay safe and thank you.